What we're going to present today is an overview of the recent advances in terms of treating GU malignancies in general. I'm going to focus on the role of immuno-oncological agents in bladder cancer. For bladder cancer, we know that we have the first-line standard of care in patients having metastatic disease, that is platinum-based therapy, but until recently we were having, for second-line patients failing platinum therapy, we only had chemotherapy with limited results. In Europe, only one drug was approved, that was Vinflunine, based on a trial that we did in 2009. In the US, we were using Paclitaxel or Docetaxel, but in fact, these patients obtained limited benefit for that. Based on the recent advances of immuno-oncological agents, what we saw initially in 2014 is that immunotherapy was working in bladder cancer, as in melanoma, lung cancer, and other diseases. And we started designing clinical trials, phase 1-2 trials. And in 2014, a paper appeared in Nature showing that immunotherapy was, in fact, of higher efficacy in bladder cancer. The field has evolved that presently we have up to 5 compounds that are being tested in bladder cancer. Initially, those trials have been done in patients failing first-line, second-line therapy. And today we are going to discuss the results of Nivolumab. Nivolumab is a PD-1 inhibitor that is now approved in the US. In the US, we have 2 compounds approved for bladder cancer. We have Atezolizumab and Nivolumab. And hopefully we are going to have even more compounds approved. The results of Nivolumab show that there are around 20-25% of patients that obtain benefit. And the patients who respond to Nivolumab, they have prolonged responses. So meaning that with chemotherapy, we see that patients have responses, but the responses are limited, are not durable. The median duration of responses are around 3-4 months. With immunotherapy, those patients that respond, they respond pretty nicely, and the responses are persisting, meaning that immunotherapy probably establishes a permanent immune power to prevent the tumor to come back. So what's the evidence that we have that this is superior to chemotherapy? We have, as mentioned, several phase 1-2 trials, and until recently we didn't have any data comparing head-to-head immunotherapy versus chemotherapy. February 17 this year, there has been this paper in the New England Journal that I am the lead author, where we have been able to compare head-to-head in second-line patients failing platinum immunotherapy based on the use of Pembrolizumab versus a standard of care chemotherapy. This trial has been a 545 patient trial, has compared immunotherapy versus chemotherapy, and has shown that there is a statistically significant survival benefit. There is a statistically significant increase in response rate. The duration of responses, the median duration has not been reached for immunotherapy, and it's 4.5 months for chemotherapy. But in addition, toxicity profile is inferior, is less frequently seen with immunotherapy, and the health-related quality of life has been superior, or the time that the patient developed deterioration on health-related quality of life is less with immunotherapy compared to chemotherapy. So that leads us to assume that immunotherapy is going to be the standard of care in second line, although we need to build on these results. So based on this data, obviously we are designing more trials and doing combinations in order to improve the results with immunotherapy in bladder cancer.